Hi everyone, my name is Tiffany Kindratt. I'm an assistant professor in the public health program at the University of Texas at Arlington. This presentation today goes over the development and evaluation of big data for epidemiology and OER for Master of Public Health students. So just a little bit of introduction here. So when I first started writing this textbook, I submitted the grant in spring of 2020. So it was actually due in February. And what I had realized and discussed with some of my collaborators was really that the research from local health departments had highlighted a need for Masters of Public Health students to get some additional training. So there was a research study that came out and it showed that the knowledge, skills, and abilities for data collection, database management, data cleaning, statistics, and data analysis using a specific statistical software called SAS was lower than what they were expecting. And so when I looked at the literature, I saw that there really was a lack of MPH programs out there that had existing course offerings and structured curriculum materials to develop these applied data analysis courses and contribute to ways to reduce those gaps and to improve those analytical competencies among recent graduates. And so a little bit of context at the time as well is I started as a faculty member at the University of Texas at Arlington in fall of 2019. And this is also when the very first cohort of MPH students started at UTA. And so just a little bit more about this institution is that we have a very diverse student body. UTA is a Hispanic serving and Asian American, Native American, and Pacific Islander serving institution. Um, they collected some data in 2020, and about 40% of UTA students had self-identified as first-generation students. And so there were many financial barriers that students have expressed. So many of our Masters in Public Health students are unable to get the scholarships or financial aid that they're able to get, say, within a bachelor's program or what they could potentially get if they were in a PhD program. And so our UTA libraries actually had come out, and I was sitting in orientation, and they talked about their CARES program, and it was the Coalition for Alternative Resources and Education for Students. And they were providing grants to fund the development of new OER textbooks, as well as some additional opportunities for people to use existing materials in their courses. And so me being a new faculty, having a lot of ideas and really wanting to train students in SAS and be able to train them into improving those analytic skills, I decided that I wanted to write a grant and develop a textbook for this. So with that in mind, the specific aims of this presentation really are to go over the development and evaluation of that textbook. And so aim one was to develop an open education textbook to train future public health professionals how to analyze secondary data from national health surveys using SAS statistical software. So my research involves mostly looking at national data sets using secondary data from publicly available data sources. This can be used for research purposes, but it can also be used for students that go into practice after graduation to, say, find some statistics about a certain health condition within their population. And so I developed this textbook and then wanted to see whether it was effective at changing their knowledge, their skills, their attitudes, whether it improved their knowledge, skills, and attitudes after completing a course that aligned with the textbook. So aim two was to determine changes in students' data analytic knowledge, skills, and attitudes after using the open textbook for completing an epidemiology concentration course in the MPH program at UTA. So with that, I developed this textbook in alignment with the course that was created for Big Data for Epidemiology, a course that was created as a core course for those interested in in EPI. And so the textbook was created and it includes 4 sections. So the 4 sections include 12 chapters, and I'll go over the different sections and the different chapters in the following slides. So the 4 sections include an introduction section, a statistics for National Health Survey section, common National Health Survey section, and dissemination and conclusions. So section 1 is the introduction. So the introduction includes 3 chapters. The first chapter is just a very brief introduction to the project and why it was needed, similar to what information I presented with you up front, and then also a little bit more background on the history of why I'm interested in doing this, why my research looks at secondary data analysis, and just leads into the overview of the National Health Surveys, which is chapter 2, which just has a very brief overview of all of the different surveys that are covered in this textbook, as well as a little bit of information on some other national health surveys that are available for people to look at national surveillance of other health issues. And then chapter 3 is a literature review. And so within this textbook, there are a lot of different research questions. There's a lot of different information related to the survey and examples. And so I give a little background of the literature review of why those examples were selected for each of those chapters. Then section 2 goes over statistics for National Health Surveys. So this textbook was created for people who should have had some sort of statistical and epidemiological background. So this is along with EPI 1 or an Introduction to EPI or Foundations of EPI course. It is expected that students will have had that before they took this course. But chapter 4 really tries to give a little bit of a background of some basic data analytics skills for those who need a refresher. And then chapter 5 goes over the complex sample design features. So national health interview surveys use all of the national health surveys, not just the National Health Interview Survey, but they all use these different complex sample design features. So it may be that they weight the data to where they take a small sample of the population and then they weight it to represent a larger sample. And it may be that they also have other variables such as a primary sampling unit or a stratification or stratum variable that is embedded within the analysis. And so the different surveys have specific procedures laid out to make sure that their results are representative of the whole population. And so that may be something that's a little bit beyond the scope of a basic data analytic course that students may have taken in the past. And so that's why chapter 5 covers those additional features that need to be covered. So then section 3 goes over common national health surveys. And so this is really the bulk of the textbook. This is the meat of the sandwich, if the textbook is a sandwich. Chapter 6 goes over the National Health Interview Survey. Chapter 7 goes over the Medical Expenditure Panel Survey. Chapter 8 goes over the Health Information National Trends Survey. Chapter 9 goes over the Behavioral Risk Factor Surveillance System. And Chapter 10 is the National Health and Nutrition Examination Survey. And so these were selected based on my previous research and research interests. So when developing this textbook, I had papers published from the NHIS, the MEPS, and the HINTS, and data analytic syntax already lined up to use for examples. Now, I had used a little bit on the BRFIS, or the Behavioral Risk Factor Surveillance Survey, in the past, and then I now have a publication with the NHANES. And so the idea is to use real research from the past to set up these chapters. And so within each of these chapters in section 3, there's a set structure. So each chapter gives a brief overview of the survey, then it goes over the data collection methods. Then it discusses the accessibility of the public use files. So it may be that some of the surveys may just have the whole survey available in one large data source. and it may be that it's separated. So for example, the National Health Interview Survey separates out their data as like a sample adult section. So if you want information about adults, you can just download that data file. If you want information about children, you download that data file. If you want information about both of them and some family level data, you can download all of them and merge them together. Whereas the medical expenditure panel survey allows you to just download one big file. And then the National Health and Nutrition Examination Survey separates it out where you can get demographics in one file, you can get like body mass index in one file, and so forth. So it goes over all of those different nuances there. Then it discusses the variables that must be included to address complex sample design features. So this is the weighting, the primary sampling units that I mentioned that is given as an overview in chapter 5, but then it goes specific to each survey within these chapters. Then it discusses the strengths and the limitations of the survey, some practical tips for conducting the statistical analysis. So there's like some little tweaks within each of the different surveys. One thing, for example, the behavioral risk factor surveillance system allows you to have state-based samples, whereas the National Health Interview Survey does not. And so it may be that you want to limit to state, and so it may have a specific tip for that. And then it has a case study based on a research question. And so this is where I present a little bit of a background literature and then a couple research questions. And then I go through step by step of how you can get that research question answered and how you can run the analysis. And so here is an overview of the research topics for each of the survey. Again, these are all developed based on my previous and existing research so that I have all of the files on hand already and have been able to tailor those and revise them and update them for this textbook and for the course that I teach that goes along with it. So for NHIS, we looked at flu vaccine uptake among Arab American adults. For the MEPS, we looked at patient-provider communication quality and flu vaccine uptake. For the HINTS, we looked at email patient-provider communication and colon cancer screening. For the behavioral risk factor surveillance system, we looked at sedentary guideline adherence by race, ethnicity, and nativity status. And for the NHANES, we looked at dementia caregiving experiences by geographic context and race and ethnicity. Now you can see that these are all very different from each other, and I have a very broad research focus looking at the different predisposing contextual factors and enabling factors that contribute to health across the life course. And so that's why there are many different aspects of that that are present within this textbook. So it could be good for some that the topics are different, and then it could be that, you know, maybe that may be confusing to people, but I kept it that way so that there is a large breadth of information covered and students are not having to look at the exact same example each time. So then section 4 goes over dissemination and conclusions. And so within this chapter, the dissemination chapter goes over how you would present the results as a poster or an oral presentation. There's a little bit of information about how you can present it by posters. And then writing the manuscript. And so within the course that I teach, students are expected to write a brief report as a manuscript. And so I go through sort of a writing recipe of what they should include in each of those sections. And then chapter 12 is the conclusion chapter. And so within this last section, it also goes over the results and how you would interpret those results if you are writing a paper. So as you're running the analysis within the individual chapters, I don't include the findings for each of the research questions. But then when you get to the end and are writing up and disseminating the results and putting conclusions together, that's where I really put that information in there for people to have and to explain their results. And so that's the textbook. It was implemented in spring of 2021 and 2022. These were the first semesters that this textbook was used. And when the textbook was used at that time, I will say it was considered the pilot because it hadn't technically been published yet. So all the textbook chapters were written, but they weren't in the formal published form at that time. And also, because of the way the course is set up, the way the semester is set up for the 15-week period, there's not enough time to do all of the different surveys. So really, it's only the only amount of time that there is to do 3 surveys. And so for spring 2021, we did NHIS, MEPS, and HINTS. And then for spring 2022, we did NHIS, BRFSS, or the BRFS, and Haynes. And so that way we were able to do all of the different chapters, update as needed, and pilot them over those 2 semesters before it actually got published within the WordPress publication software. And so when it was piloted, we did pre and post surveys, so knowledge, skills, and attitudes towards data analysis topics. So students were asked questions on a Likert scale from 1 strongly disagree to 5 strongly agree. And then open-ended feedback was obtained for the UTA libraries on the use of the open education resource. So I kept my data quantitative and then collected some qualitative data for the library. And so the questions were, please rank your level of knowledge regarding the following. And then it was set up with some examples, including types of data, distributions, study designs, and methodologies. Then they were asked to rank their confidence in their ability to conduct the following skills. This is where we got to the data analysis. And then please rank your level of agreement with the following attitudes. And this was things like the importance of learning these concepts for their future career. So here are the results. So the textbook was published on August 1st, 2022. And here you can see there's a QR code for the link to the textbook, and also this is what the cover looks like. I was also able to obtain some Google Analytics for it. So when it was published until December 16th of 2022, there were 7,661 page views and 1,578 downloads. Then in spring 2023, there were 2,522 page views and 97 downloads. So there were the course that I teach that has this doesn't have a lot of students. It's maybe 10 at max. So there's been a lot of other people that have looked at it, which is really exciting to see. Then the UTA Libraries also has this really cool visualization to where you can see the global reach of this specific textbook. And so you can here see that there was over 9,000 sessions, and you can see all the different places where the textbook has been used. So it definitely, we're in Texas, so there is a large number of views here, but then there's also a large number of views on the East Coast. And then it's really neat to see that there are people in Australia and Europe and South America and Africa and Asia who have viewed it as well. So along with publishing the full textbook, I have also published the companion data files in the data repository. So these were published on June 28th, 2022. And the QR code here links to that as well. So overall metrics, so as of the 5th of October 2023, there was 1,976 page views and 188 downloads there. So this actually wasn't published until after the pilot testing here. So the data wasn't actually in the repository yet. I had posted it on my website. So this is all since the publication. And so that's really neat to see as well, that these people didn't just download it for the course I taught, that these are actually other people who have downloaded the data. So here are the results from the student evaluation. So here you can see for the improvements in knowledge. So there were no improvements in people's knowledge of different types of data or differences between independent and dependent variables. And that's expected because they know that information from other courses. However, there were increases in knowledge when looking at differences between non-parametric and parametric tests, national health surveys used for morbidity and mortality data, advantages and disadvantages of the National Health Surveys, study designs, methods used for collecting National Health Surveys, and the complex design features used. Then looking at skills, there were really big improvements in the skills and their confidence in their ability to critically appraise research studies from the surveys, interpret statistical results, download the data sets from the government websites, import them into SAS, write syntax for conducting basic and some more advanced statistical procedures, as well as interpreting those results, creating tables, and planning their own study. So it's really great to see that their confidence improved in all of these skills that were originally identified as being low by those public health departments. Now, when we look at attitudes, there wasn't a lot of change in the attitudes, but here you can see that the means were actually very high at the beginning. So the only one that was statistically improved was the ability to master the content in this course with a hybrid design. So these were courses that were online, asynchronously, and then also had some synchronous sessions. And so the first semester was completely online, but had 3 synchronous sessions online. The second one was mostly online asynchronously. It had 3 sessions. The first session was in person, but then just due to student obligations and the ability to have to drive all the way across a large metropolitan area, then we made that virtual as an option there. And so some of the feedback on the OER important aspects of it. So the library really is looking at uh, the use of the textbook and providing resources for students that are free. And so here are just some great comments that I found within um, in the feedback survey. So free textbooks for education would greatly help save money for our students and give a larger incentive for learning before registering for courses, as well as maintaining the same engagement levels throughout the course semester. I have no doubt that this would impact students' learning retention after the courses are completed. Another student said, thanks for thinking of free resources. Another said, I think it's a great idea using these types of resources. These resources are very economical. And one said, one of the best courses in data instructors. So it's really neat to see all of that feedback that students really appreciated the course and the fact that their resources were free. And so in summary, this textbook was written to accompany an MPH epidemiology concentration course that fulfilled a need for training future public health professionals on how to conduct data analytic procedures using secondary data from national health surveys. The results indicated that it really improved students' knowledge of national health surveys and their skills using SAS syntax on several domains. And the students really provided some positive feedback on the use of these free educational resources in their courses and demonstrated an interest for more open education resources to be developed for public health disciplines. So I hope that this program will continue at this institution, and I hope it will continue at other institutions, and we can have more available for our students. Okay, so that is it. Thank you so much for listening. Here are my acknowledgments, my program chair and program director, as well as the library. And then also this is my contact information and my website that has other information about the textbook and some teaching materials. So if you're ever interested in developing a course like this, I'd be happy to do what I can to help you out to create it and implement it. Thank you so much.